Right, okay? Mary, does that look right?
Yes, I can see it fine. Thank you.
Okay, thank you all for your patience. Let's try this again. So right now we're at our lowest level in many, many months in terms of our long-term care facility outbreak team and their support that they're providing to long-term care facilities in Alameda County with open cases. You can see here we're down to 41 open cases. We reached a high of 167 open cases or long-term care facilities with outbreaks, and that occurred in late December. Here's an update on the Centers for Disease Control Federal Pharmacy Partnership Program. Many of you have had at least 2 clinics already with CVS or Walgreens, and as of last Thursday, they had administered all 47,000 doses. But so by today, we're well past 50,000 vaccine doses administered to long-term care facility residents and staff right here in Alameda County. Looks like you guys are doing a good job having your staff accept the vaccine. If you have time between the second and third clinic, if you haven't had your third clinic yet, which most of you probably haven't had your third clinic yet, please meet with all your staff individually and ask them if they would consider getting their first dose at your third clinic. It's perfectly fine for your staff to get a first dose at a third clinic, even though CVS won't be coming back, because you have plenty of options to get that second dose, and your residents have plenty of options to get that second dose right here in Alameda County. So no one should turn down the first dose just because it's your third clinic. Please try to convince as many residents and staff as you can to accept the vaccine, because if you do, you position your community to open up more and more and get back to life as we knew it way back in 2019. So this data is pretty impressive. CVS and Walgreens have done a great job, and we've helped them move faster and serve you faster, because here at Alameda County, we also contracted with local pharmacies and allocated doses to them and sent them out to hold clinics. In some cases, we took big RCFEs right off the CVS list, and we served them because we needed this to go as fast as possible. And these 3 pharmacies are still out there holding clinics, primarily in low-income housing for seniors, apartment dwellings for seniors. So they are very busy administering doses right now. In addition, we also gave vaccine doses to facilities who could vaccinate their own, like skilled nursing facilities, and we invited staff to our vaccination pods. And close to 1,500 doses have been administered to long-term care facility staff at our Alameda County pods. So all of this work resulted in CVS going faster and administering more doses. So we worked together with them. Now things are going to change, right? Because the clinics are coming to an end, and no one will be coming out and holding clinics at your facilities after the third clinic. So just a reminder, a couple weeks ago, we sent this letter out to all the hospitals and skilled nursing facilities. So please, it's very important that you try to work with acute hospitals and skilled nursing facilities to get individuals vaccinated before they are admitted to your facility, but certainly do not turn down new or readmissions if they're unvaccinated. Simply admit them into a yellow zone or yellow status room and begin the process of helping them to get vaccinated. So here's your options to take advantage of to get doses when your clinic ends. Number 1, as I mentioned, work with acute hospitals and skilled nursing facilities to administer the vaccine before discharge. Number two, contact your local contracted pharmacy. Contact the pharmacy that you get all your medications from for your residents and ask them, when will you have the vaccine? Because the way that this will work in the future is when a resident is admitted, you'll simply order the dose that you need from your pharmacy, and that dose will come along with their medications. So you got to start that conversation now to determine when they will have vaccine supply, and start to work with them. But primarily, if they don't have supply, then you and the long-term care facility staff that you work with and your residents can just keep coming to our vaccination sites being held throughout Alameda County. And in order to find those sites, click on that link. We'll send you the slides after, so you have that link. But that's just a link to the Alameda County website that shows you oops, what happened to them? Oh, all the vaccination pods available to you. So for some of you, of course, you're going to have to go to a drive-through, and you would take residents through the drive-through in order to get their first or second doses. It's very important, of course, that people get 2 doses of Moderna or 2 doses of Pfizer or 1 Johnson & Johnson, but they can't mix them up. So it's very important that you go to the pod and the residents go to the pod that have the vaccine that was utilized for the first dose. And if it was CVS who held your clinics, then of course that would be the Pfizer vaccine. And we have Pfizer vaccine at Alameda County pods. Please consider the data and how compelling the Pfizer vaccine efficacy is, and what we're seeing in Alameda County and throughout the country. The impact of this vaccine is incredible. Not only are we seeing that it reduces hospitalizations, reduces ICU admissions, reduces death, but it reduces cases. It's proven itself that it will stop the virus from spreading. And the CDC basically said that today. So the higher your vaccination rate, the more likely you will put outbreaks behind you. You can see the severe decline in cases amongst nursing home residents around the country. It's a 90% decline actually since December 20th. And this is about a 65% decline in terms of mortality as a result of the vaccination program going on throughout the United States. So now I want to alert you to what was just released a couple of hours ago, which is an AFL directed to all long-term care facilities. So that would be you and skilled nursing and board and cares and RCFEs. So this AFL is the 6th revision to the Visitation AFL. And here on this slide, I give you the background of all the different changing guidance associated with visitation policies in your facilities since March 11th on 2020. I do want to alert you to, within that set you see here, we have health officer order, which imposed additional requirements related to visitation during an outbreak. So in the case of visitation, Alameda County has slightly stricter requirements, and I want to make sure that we continue to adhere to those, even though this AFL has changed visitation in the context of vaccinations. And of course, this is just the beginning of a massive amount of changes that will come associated with vaccine and the vaccination rates and the dropping case positivity rates in Alameda County. In 2 days, we will be in the red tier. We've been in the purple tier for a very long time. And when we move into the red tier, that will lead to additional changing guidance in our county and for you. So generally speaking, you still have to cautiously move forward. For most of you, you hadn't have your third clinic yet. So please cautiously move forward when we talk about visitation. Consider that this AFL specifies that you'll have to continue to adhere to all the screening practices, all the basic core principles of infection control related to COVID, and the testing requirements. So nothing has changed in those regards. The only thing that is changing here is related to visitation. And here, of course, are those core principles that we'll always have to adhere to, that will likely become new regulations if they haven't already. And this should be put up on a sign that can be clearly read by all your visitors, because you reserve the right to ask a visitor to leave who is not following the core principles of infection prevention that you see here. So as we've discussed in the past, now we have 3 risk levels associated with visitation. We have the lowest risk, which is outdoor visitation with people masked up and safely distanced and wearing proper PPE. We have medium risk visitation, which is held indoor in large open communal spaces, again with safe distances and masks. And then we have the highest level of risk, which is indoor in-room visitation. And indoor in-room visitation has been put on hold for many, many months, except for the compassionate care exceptions that we've all come to understand as being more than just end-of-life visits, but it's really a person-centered approach to making exceptions for indoor in-room visitation. So this new AFL basically directly addresses indoor in-room visitation in the context of vaccinations. So AFL 20-22.6 just came out. Again, it's addressed to all long-term care facilities. And it starts out by saying that due to the progression of the vaccination rates in California, CDPH is revising the visitation guidance. But you must remain vigilant, monitoring for breakthrough infections and transmission through ongoing surveillance and testing. And breakthrough infections is defined as individuals testing positive that have been fully vaccinated. And the definition of fully vaccinated is that they've received both doses and it's been 14 days since their second dose. And that enables the body to build up the full amount of antibodies to both fight the infection and stop an individual from contracting the virus, as we've learned due to our huge national experiment with the Pfizer vaccine in long-term care facilities. So coming back to this AFL 2022.6, talking about indoor in-room visitation. So facilities shall allow indoor in-room visitation for fully vaccinated residents who are in your green or yellow areas, regardless of the fact that we're still in the purple tier. Okay, so we have the blueprint for a healthy economy with our different tiers. Doesn't matter in this case. Fully vaccinated residents in the green or yellow areas can accept indoor in-room visitation. Unvaccinated or partially vaccinated residents, so those would be residents who aren't fully vaccinated, who are living in a green or yellow area, can accept indoor in-room visitation when we're in the red, orange, or yellow tier. And like I said, we're going to be in the yellow tier in 2 days. So just digest that for a minute. So I turn that into a little graph to make it a little easier to understand for us. So again, this is specific to indoor in-room visitation. So if the resident's vaccination status is fully vaccinated and they're in the yellow or green cohort, they can have indoor in-room visitation, even if we're in the highest risk tier of purple. But the visitor has to be tested negative of COVID within 2 days of the visit, okay? Because we're not really talking about the visitor's vaccination status. We're only talking about the resident's vaccination status. So once again, if you got a fully vaccinated resident and they're in the yellow or green cohort, then a visitor can come in and visit with them in their room as long as they show you a negative test result and they've been swabbed within 2 days of that visit. Moving down to the next section, if a resident is unvaccinated or partially vaccinated, again, they can accept indoor in-room visits. If the resident is in the yellow or green tier, as long as we're in, that should be red tier 3 or lower, okay? There are certain conditions that have to be in place for you to implement what you see here. Number one, people have to wear facial coverings and remain physically distanced. However, if you have a fully vaccinated visitor who also tested negative within 2 days, and they're visiting a fully vaccinated resident, this AFL says that they can have brief physical contact, a hug or holding hands. But they still don't want visits, indoor in-room visits, to occur if there's a roommate in the room. So let's be mindful of that. And if the person's visiting a resident in the yellow zone, or if they have a yellow status, a person under investigation, or they've been exposed, then that visitor should wear full PPE. And according to our county, the additional restriction is this, that you can't allow indoor in-room visits if you're having an outbreak, if you're in response-driven testing. You can't allow indoor in-room visits, but you can still hold communal space and outdoor visits, even if you're in an outbreak. And here's that health officer order that was issued just before Thanksgiving, which specifies what I just highlighted on the previous slide. So AFL 20-22.6 also talks about communal dining, bringing group activities back, and letting contractors come in, as long as, again, we all follow the core principles of infection prevention. So communal dinings and activities can start up again, as long as residents are not on isolation precautions or quarantined. They can come together and eat with their socially distanced with a limited number of people. They can eat meals together. They can have activities together. But again, you do this very slowly, and you do this in groups of residents that you always kind of keep together as their own, if you will, cohort. So that even if you had someone test positive, the number of people that you would have to test would be a small number associated with the group that they've been eating with or having activities with. Now, you may have heard today that the CDC provided an update that basically will influence what the Centers for Medicare and Medicaid Services advises, which will influence what CDPH does next, which will influence what the Department of Social Services puts out there and pins. So like I said, this is just the beginning. And whenever CDC makes a big move like this, you should expect and you should be thinking ahead of how guidance will change for you. But remember, you have to be patient and wait for the guidance to change for you. Just because CDC puts something out there what you have to know is that there's a flow to this, right? That I just described, CDC to the Department of Health and Human Services, or CMS, for their interpretation, to CDPH, to CDSS, and then to the counties. And all along the way, any one of those groups could make things more restrictive than what CDC is putting out here. But basically, they put out today that in non-healthcare settings, and I'm not sure that we would consider RCFEs as healthcare settings. So in non-healthcare settings, basically we have the highest concentration of vaccinated people in our RCFEs and skilled nursing facilities. It says that people who are fully vaccinated can gather in small groups without mask or social distancing. Fully vaccinated can visit with unvaccinated without masks or social distancing if the unvaccinated are a low risk group. And fully vaccinated do not need to quarantine or get tested if they remain asymptomatic after an exposure. So these are the three kind of blockbuster uh, moves by CDC that came out today. Please don't do anything with this yet. Just be informed that changes are coming for you as a result of this. But also bear in mind that there's a reason why CDC did this right now. And they did it right now to try to convince more people to get vaccinated, because this is what our world will look like. Some things will be open for those who've been vaccinated. Doors will be closed for those who chose not to be vaccinated. And so while CDC is never going to mandate that everyone get the COVID vaccine, it's going to leverage guidance and policies like you see here to try to influence people to accept the vaccine. And you should do the same thing. You should utilize this information to try to convince more of your staff and residents to accept the vaccine before your third clinic ends. Also, last week, PIN 2114 was released, and this was all information related to the vaccine. And it basically covered, hopefully, things that were just a review for you. I don't see any new information in this PIN. It's basically a nice summary of all we've really known and implemented related to the vaccine. Certainly read through it and make sure that you're following this guidance if you have some clinics left. But I don't see anything, new or interesting that I don't think that you or I already knew that came out in this PIN. Also last week, some pretty cool fit testing resources were released. Again, as a reminder, OSHA would expect that you have started a fit testing program if you're using respirators within your facility. However, you can learn how to do your own fit testing. And here's a couple of very cool videos that are free to anyone that gives a really good a how-to video on how to appropriately fit test an N95 respirator. I usually always pause here, Mary, to see if there's any announcements from the Ombudsman.
Thank you, David. Seeing how Nicole is not able to attend today, I think we'll hold off announcements for next Monday. There are none to my knowledge that I know of that she shared with me.
Okay, great. Thank you. Yep. And that concludes our slide deck. So I'm open for you to come off mute and ask any questions that you might have. And I'll see if there's anything in the chat or the Q&A. Are you seeing anything in the chat, Mary? No? Okay,
I don't see anything in Q&A or in chat, David.
okay, that's fine. Good. Any questions from anyone? Okay, well, that's fine. Hearing none, we'll continue to be offering these webinars to you to help you keep track of all the changing guidance, and so you can expect for the next 3 or 4 weeks, maybe 5 weeks, we'll just be a good resource for you to keep you up to date related to all the changes. Please work hard to try to keep your vaccination rates up or get them even higher. As I mentioned, that will open up your community to achieve some sense of normalcy as soon as this spring. Here's my email address. If anything should come up related to vaccine access for your residents or staff, don't hesitate to reach out. And with that, I guess we'll sign off. Mary, I thank you so much for supporting our webinar today, and I thank all of you for taking time out of your busy day to tune in.
Thank you, David. We really appreciate it for all the information.
All right, great. Have a wonderful afternoon, everyone. Thank you.
Thank you.